right, hello there, Avery. My name is Dana Gonzalez. I'm a nurse practitioner student, and today I'm going to be assessing your heart, okay?
Okay.
All right, do you have any issues with any pains in your heart, like when you're running around playing or anything?
No.
Good. All right, so we've already assessed her vital signs, and they're all within normal limits, and her general appearance is healthy and well-nourished and appropriate for her age and ethnicity. So first, I'm going to just inspect for any jugular venous distension and any carotid pulsations. So Avery, go ahead and turn your head to the left. Okay, and just relax. All right, and I'm not seeing any huge distension or carotid pulsations other than what we would normally expect. And I can see the point of maximal impulse of the jugular pulsations right about here on her neck. So now I'm going to go ahead and measure her jugular venous pressure. And Avery, I'm just going to be using this ruler to kind of put this right here. Keep your head to the left there. Right about there. And her jugular venous pressure is about 2 centimeters, which is normal, okay? Next, I'm going to feel on the sides of your neck to check your carotid pulse, okay? So just relax. Sorry, my hands are cold. And her carotid pulses are equal and with a brisk upstroke. I don't feel any thrills or anything like that, so I'm not gonna assess for a bruit at this time. Excuse me. And then I'm also going to touch in your chest right here to assess your point of maximal impulse, which I can feel right down here where it's supposed to be. All right, and then I'm also going to put 3 fingers here on your chest here on your 3rd through 5th intercostals to feel for the systolic impulse. Okay, good. And then I'm just going to put a couple fingers here to feel your pulmonic area and over here for your aortic area. And again, I'm not feeling any thrills or any abnormal pulsations. Excuse me. And I'm not going to do any type of percussion. And like I said before, I didn't see any reasoning to assess for carotid bruit. So now I'm going to listen to your heart, okay? I'm going to listen to your heart in 6 different spaces. All right, so first is going to be the aortic area. And then the pulmonic. And then at the 3rd, 4th, 5th intercostals, and then down here at the apex. Good, just keep breathing normally. I'm going to switch my stethoscope around to use the bell to listen at your apex again. Okay, and Avery, I'm going to have you go ahead and roll over onto your left side for me. All right, and I'm going to use this again just to listen down here in a different position for any heart murmurs, okay? Good. Okay, so I didn't hear any extra heart noises, any S3 or S4. I didn't hear any murmurs. I didn't hear gallop. The rate was regular. Rhythm was normal. Everything seemed pretty good. One last thing, I'm going to have you sit up straight up for me. All right, perfect. And then I'm going to flip this back around and go ahead and lean forward for me a little bit here, just like that. You could put your chin up if you want to. All right. And I'm just listening along the left sternal border and the apex for any more potential murmurs. Okay, and like I said, I don't hear any murmurs or anything. Your heart sounds great. Thank you so much for helping me.
Yeah.